Chronic sinus problems affect millions of patients across the U.S. Chronic inflammation can lead to chronic sinus problems. Chronic inflammation can be triggered by many sources. These include recurrent bacterial or fungal infections, untreated or undertreated allergies, smoking, including repeated exposure to secondhand smoke, and possibly exposure to various environmental irritants. Medical treatment of chronic sinus complaints involves aggressive therapy to decrease this inflammation. Medical therapy is successful for most patients. However, for those patients that fail maximal medical therapy, there are surgical options available. Surgical interventions for sinusitis require a thorough knowledge of nasal sinus anatomy. The complex nasal sinus anatomy is composed of structures made of bone, soft tissue, and mucous membrane. Inflammation creates swelling of the mucous membranes inside the nose and blocks the small drainage pathways of the sinuses. Chronic inflammation predisposes patients to have chronic sinus infections. Your doctor may at some point order a sinus CT to better assess your anatomy and the changes that have occurred from chronic infection and inflammation. Sinus surgery addresses these areas of disease to reopen the natural drainage pathways of the sinuses. Endoscopic sinus surgery is performed entirely through the nose under direct visual guidance using a special scope and video monitor. Your doctor will use various instruments to remove diseased mucosa from your nose. In addition to instruments that remove tissue in areas of inflammation, your doctor may choose to use endoscopic balloons to dilate the openings to each sinus. These balloons are less traumatic to the delicate normal mucosa in the sinuses and also help to reposition the bone underneath inflamed mucosa to improve drainage. Your doctor will use a guide wire to help position the balloon in the proper position prior to inflating the balloon. After placement, special catheters can also be used to irrigate the sinus to improve healing. Please talk to your doctor if you have any further questions regarding treatment of chronic sinusitis. Thank you.